the things you mentioned, which is something I hadn't thought about, but is the issue of radon in our basements. That's something I don't think is very much publicized. So talk about that a bit.
Exactly. I think it's something that so few people are aware of, but it's actually the second leading cause of lung cancer in this country after smoking. It results in tens of thousands of excess lung cancer deaths. And what radon is, it's a radioactive gas that naturally occurs in a lot of areas of the United States.
Hello, everyone. I'm Ron Roel, the host of 45 Forward. Like a lot of folks, as I've gotten older, I have a few major concerns about my health. Mainly, I worry about the big three: heart disease, cancer, and Alzheimer's. But the big C of the big three is cancer, and in many states is overtaken as the major cause of disease. And there are lots of different forms of cancer. They don't discriminate, and they affect people of all ages. So it's always in the back of my mind. So today I'm really gratified, especially during National Cancer Prevention Month, to have as my guest today Dr. Adam Barsouk. Dr. Barsouk is the author of the recently published book, Outsmarting Cancer, Risk Reduction and the Power of Prevention. He's a resident physician at the University of Pennsylvania, an oncology researcher, and science and health policy author. Now, there's a lot of ongoing research about treatments and cures, and lots of fundraising efforts out there. But it's Dr. Barsouk's focus on outsmarting cancer that's particularly impressed me in my own goals of helping people age well and successfully. And that focus is on prevention, cost-effective approaches to risk reduction. What can we do about preventing cancer? Not just wait around and see what happens. So we're going to talk today about a number of factors that contribute to cancer, some of which you may not be aware of, what's behind the increase in cancer rises worldwide, especially in our children, and what lifestyle changes and social reforms could help. So now let's meet our guest, Dr. Adam Barsouk. Welcome to the show.
My pleasure to be here.
Yeah, pleasure again to have you. So before we get into a lot of the elements of your book, which I found terrific, a lot of people do have a personal story about cancer, and you do too. So let's just tell us a little bit about your story, about how it's connected to your life.
Unfortunately, cancer may run in my DNA. I lost my close grandparents who raised me to rare blood cancers early on in life. My family is from Ukraine, and they actually live not too far from the Chernobyl nuclear accident. So I
Wow.
wonder if that's something that may have caused their demise, a mutation that I may carry in my genes. And it's also what inspired me to go down this road to being a cancer researcher, being a cancer clinician, and also wanting to get the word out there about all the different preventable causes of cancer to kind of prevent families like mine from having to go through the suffering that we have.
Right. Yeah, it's a compelling story. A lot of people have personal stories. I mean, we see these sporting events where people can go, stand up for cancer. I stand up for, my dad, and so forth. So it's important to have that personal passion connected to your research. So I appreciate that. So just briefly, so what is there to cancer prevention besides things like smoking cessation?
Yeah, so I think what a lot of people aren't aware of is the latest data shows as many as half of all cancer deaths are actually preventable worldwide.
Hmm.
And that prevention can take a lot of different forms outside of just smoking cessation. Without a doubt, smoking is still the number one leading cause of cancer, but it's by and far not the only one. The second leading cause that's on the rise in the US and many developed countries is obesity, right? A number of different cancers are associated with obesity, and it's not just colon, it's colon, rectal, breast, lung, and non smokers. The list goes on and on. So we know that obesity is a huge leading cause of cancer. But even that is not the whole puzzle, right? We're learning more and more that environmental pollutants, air and water quality, microplastics in our water, ultra processed foods, radioactive gases like radon. There's so many different aspects of our lifestyles that all contribute to our cancer risk.
Wow, it's a lot to consider. um, now, yeah, even I think you've mentioned that simple solutions like sunscreen, wearing
Hmm.
hats, cut skin cancer rates, and and the other question, one of the questions that come up in recent years, of course, is the connection between long COVID and
Hmm.
cancer risk. What about that?
So that's an excellent question, and it's an area of continued study. We know that a lot of folks who had COVID have been stuck with long COVID, where they have this immune over response for months, for years after. And at least in the test tube in the lab, we know that that inflammatory reaction, that immune over response, is associated with cancer developing. Now, that hasn't, it hasn't been, it's been too early for us to be able to observe that in people. I think it'll take years before we know that for sure, but that's
Mm-hmm.
definitely a risk. What we do
Mm-hmm.
know, though, is that all the folks who missed their screenings because of the COVID shutdowns, their mammograms, their colonoscopies, their lung cancer screening, that in and of itself is going to lead to tens of thousands of additional cancer deaths because we're not detecting the cancers early like we should. So it's so important for folks who have been out of touch with the healthcare system to get back in touch and make sure that they're getting the screenings that are appropriate for them.
Hmm. Yeah. Um, yeah, and I guess we're working on improving dietary recommendations, as you mentioned before. Obesity is a major cause. Um, what about certain? We people do worry about weight loss, and are there certain links or possibilities with the weight loss drugs like Ozempic?
Yeah, that's an excellent question. We know that obesity is associated with a whole host of different types of cancer, and a lot of people suspect that the weight loss revolution with GLP-1s like Ozempic, Wegovy, Zepbound, we're actually going to see fewer rates, lower rates of those obesity cancers decades down the line because of the weight loss reduction. There
Hmm.
is a small associated risk with like medullary thyroid cancer potentially, and people who have a family history of it. But by and large, these drugs like Ozempic are safe for most people and may in fact reduce cancer risk. But that's really just one piece of the puzzle. It's important to remember
Hmm.
that they work temporarily. So if you stop the drug, typically all the weight comes back. And so that's why it's so important to use these drugs. What I tell my patients is a tool to work on lifestyle, to work on diet, on exercise, instead of just relying on it entirely to help lose the weight.
Right. Right. Yeah. It's always like, oh, I can do something besides exercise. People look for those first, but actually, I think it's really critical the piece of it. Um, I think even in my work, just I do presentations about risk prevention for Alzheimer's, not as a professional, but just as an advocate. And one of the things they say for if you could do one thing to lower the risk of Alzheimer's, it's exercise. So I think
Exactly.
that's probably yeah. So now one of the things I mentioned in the intro, which you mentioned too, which is troubling, but the rise of the cancer epidemic among young people. So let's talk a bit about that. What's that about?
Yeah. So we've seen the rates of cancer in young adults, which is defined as those under 50, more than double in the last 30 years. And it's a harrowing trend, right? I'm
Mm-hmm.
afraid, and truly, I see it day in and day out in my clinic. So many young folks who are new parents, even college students, are coming in with cancers that previously were seen in people who are 60 and 70. It's scary. And the truth is, we haven't quite gotten to the bottom of it. We know that obesity is a huge contributing factor, but there's definitely far more to the story. And that's why I'm so worried. And so much of my book is about the latest evidence about ultra processed foods, microplastics, other pollutants in the air and the water, because without a doubt, there is some underlying factor. There's something we're missing, or probably a combination of factors that is leading to this rise. And that's why people need to be aware of it. And we ought to be trying to titrate our lifestyles, adjust accordingly to try and minimize that risk.
One of the things you mentioned, which is something I hadn't thought about, but is the issue of radon in our basements. That's something I don't think is very much publicized. So talk about that a bit.
Exactly. I think it's something that so few people are aware of, but it's actually the second leading cause of lung cancer in this country after smoking. It results in tens of thousands of excess lung cancer deaths. And what radon is, it's a radioactive gas that naturally occurs in a lot of areas of the United States, and it accumulates down under the ground, particularly in basements. And a lot of folks are not aware that they have it, and so they breathe it in for years. What I recommend is that everyone look up their zip code online. You can see if your area is one that has a high risk of radon, and if it is, it's so important to get a radon test You can even get
Mm-hmm.
them on Amazon. They're not very expensive. But it's important to test your basement and to, if the levels are high, to install a radon pump, a mitigation system, because it can significantly increase lung cancer, especially for younger kids, young adults, who have decades ahead of them. In the long run, it can be very deadly.
Wow. Wow. So, are there any special websites? I guess if you just Google radon inspections or something like that, would
Yeah, and there's actually most states, and there's a government website. If you Google like
okay,
your zip code and radon levels, you should be able to see if you're in a high risk zip code.
good, okay. What about in terms of prevention? You talk about supplements, medical lifestyle supplements, um, but very few have been shown to be effective in reducing cancer risks. Have there been any ones that we should avoid, or the ones that may be more helpful from your experience?
There are definitely many supplements to avoid. One
Mm,
that comes to mind, vitamin E, was actually shown, E as in Edward, was shown to increase risk of lung cancer in smokers.
really?
So would highly avoid that one for everyone.
Hmm.
Any supplements that you're on, you ought to let your doctor know because many of them interact with other medicines and that can be life threatening. As for which ones are helpful, the truth is that supplement companies are not required to test their supplements for efficacy. There's no FDA approval process like there is for drugs. So we don't really have much research and there's not much data on which ones are helpful. And the companies don't have much of an incentive to do it either because it's much easier to just advertise and say you can do something than invest hundreds of millions of dollars into a clinical trial. The one supplement that I do caution has the best data, and it's one that is readily available, very affordable, is vitamin D, as in dog.
Hmm. Mm-hmm.
Vitamin D has been shown to decrease risks of multiple sclerosis, decrease the risk of depression if you take it, and there is some preliminary data about decreasing risks of certain types of cancer as well. So that's one that I would recommend, especially for folks with darker skin who live in areas where there's a long winter. That makes it, yeah,
Hmm.
most people like that are actually vitamin D deficient. So it's pretty good to take a vitamin D supplement every day. Outside of that, there's really not much evidence for most
Hmm.
supplements, and I typically tell my patients to steer clear of those.
Mm-hmm. Yeah, it's interesting. I hadn't heard about E, so that's is hasn't E been traditionally used for supplements for your skin and so forth, or
Yeah, there's some
something else?
vitamin E creams, and the creams are fine because they're not getting absorbed systemically, but I wouldn't take any oral vitamin E pills.
Hmm. Getting down to more tricky questions about why hasn't there been more of a focus on prevention? Um, I have a couple of theories. What are your thoughts on that?
Yeah, well, it's kind of like Willie Sutton said when they asked him why he robs banks, because that's where the money is. Right. The truth is there's no money in prevention. The pharmaceutical
Mm-hmm.
companies, they have a lot of incentive to pump out new drugs, which they can make hundreds of millions of dollars off of. Many of them are without a doubt effective and they can prolong survival, but there's really no mechanism for people or companies or anyone to profit off of prevention, right? We know prevention saves the healthcare system enormous amounts of money. Certain, for instance, vaccines like HPV vaccines, hepatitis vaccines, if you were to invest $1 in those vaccines, you would save $20 down the line as a society because they
Mm-hmm.
prevent so many later repercussions like cervical cancer, like liver cancer. But it's all public health. It's not something that a private company can make money off of. And
Mm-hmm.
especially in this current environment, in the current administration, so much funding towards research and public health has been slashed. So it's something that we desperately lack, that we invest less in as a country than any other developed country. And that's
Mm-hmm.
probably why, we live on average 10 years less than our counterparts across Europe.
Yeah. Well, I think the focus on money is important. I think it's also the way we count money. Um, so if you look at the budgetary process, I often my concern is that what I say is we need a higher math. We look at what we spend, not what we. It's harder for people to calculate how much we're saving. So,
Hmm.
similarly, I've advocated for older folks getting home care.
Hmm.
They say, well, that costs this much more money in the budget, and I say, well, the argument is yes, but it could save so much for that down the road by not having people go into nursing homes. But
Exactly.
savings don't get calculated. It's not part of the calculus of budget processes, and I think it's really unfortunate because, as you say, it's well. One of your quotes at the beginning of your book is from Ben Franklin, right? An ounce of prevention is worth a pound of cure, and certainly now we're, $1 billion in prevention is worth a trillion in cures. So I think that yeah, it's still it's just a systemic problem. I'm not sure how we're going to do
Yeah.
that, but it is. I think if we can, well, if there was some way to quantify the data in terms of and calculate, this, and I think we can probably do that. We could probably have the capacity to do that. It just takes some work, and it takes a little bit more than short-sighted budgeting year to year. So,
Exactly. I
yeah.
think I think in terms of even like low-hanging fruit, right? These days we've seen that the administration advance Medicaid cuts. They're floating decreasing the subsidies for the Affordable Care Act, right? And all of those things that, to your point, the amount of money we spend to let people get their preventative health screenings for a person on Medicaid is so much cheaper, so much lower than how much we're going to be paying down the line when they end up in the hospital because they don't have insurance, because they have all these chronic problems that we're not controlling. So it's very short-sighted when we try and kind of save money on easy prevention at the expense of healthcare costs ballooning in the years to come.
Yeah, I think the problem to that as well is to name it is that, well, people make money off of off of
Yeah.
a lot of treatment and hospitalization, and so there's incentives on that side to again, well, it can, so it contributes to the economy, so to speak, but all this healthcare spending, but not to the quality of life, as you well know. um, so and do you see, I guess, that that the Medicaid cuts will have an impact on cancer research and on the incidence of cancers.
Without a doubt, because you have young folks who are not getting their colonoscopies, who are not getting their mammograms, not getting their vaccines, so that in and of itself is going to lead to many more cases of metastatic cancer. To your point, Alzheimer's, heart disease, if people aren't getting their blood pressure medicines and aren't checking their cholesterol, imagine what that's going to do to rates of heart disease 5, 10 years down the line.
Hmm. Yeah. Um, so, and I know that one of the issues that you talk about is when considering these things that we're in an era of mistrust, general
Yeah.
mistrust, including that of doctors and the healthcare system. So, how do you handle that? How do you rebuild that trust?
I think without a doubt, we've seen growing mistrust, especially since the COVID pandemic. There's so much misinformation out there. I think a lot of folks, on the layperson side of COVID, saw their businesses shut down. They were forced to wear masks, what have you. They didn't necessarily see the side of it that I saw, which was in the hospital running out of ventilators, tens of patients dying every day. It was awful and it was traumatizing. And I think since then we've been having greater and greater divergence between the medical community, what the research that's being done, everything that we're learning on the scientific side, and what average day people hear and know about, because they're not getting their news from reputable news sources. They're getting it from random folks on TikTok or YouTube or what have you. And I think it's so important to have folks, quite honestly, like me, to have folks who are writing these kind of books and trying to reach out to general audiences to try and bridge that gap and kind of bring people back into the fold. I think what I often, because I have many patients who don't want to do vaccines or don't want to do the medicines I recommend due to mistrust, and what I often tell folks is people don't realize it's not the same kind of medicine like people may assume 20, 30 years ago, where doctors are making more money from prescribing more treatments or recommending more vaccines. Most doctors these days are salaried employees of a health system. We get the
Hmm.
same base salary. We take home the same regardless of how many drugs we prescribe or how many vaccines we give to people. So our incentives are actually aligned with yours as the patients. Our goal is just to help patients live longer and to not get sued for malpractice. Right? In truth, the people who we really shouldn't be trusting are the people, the podcasters, the other folks trying to sell supplements online. They have an incentive to sell their product, to tell you
Hmm.
whatever they can to make money. Same with insurance companies, with healthcare systems at large, right? Those are the folks who make more money the less services that you receive. So if you think
Mm-hmm.
about it, the doctor and the patient actually have, once again, incentives that are aligned. They are the two who are most closely trying to work together towards the greater good. And that's why it's so important that people trust their doctor, that they can confide in their doctor, and not, I think it's so important to dissipate this idea that we're somehow trying to get a step up on you,
Right. Right.
that we are in some way trying to pull something over our patients.
Right. Yeah. So, just as we finish up here, what you have a few takeaways in terms of what do you think are the most essential aspects of preventative care or prevention for cancer that people should, if they have two or three bullet points, what would they be
Yeah.
for you?
I mean, without a doubt, if you go just by the data, smoking
Mm-hmm.
remains the number one leading cause. Whatever you can do to minimize your smoking intake as well as secondhand smoke. After that, obesity and especially ultra processed foods, which increase the rates of obesity, but also in and of themselves probably increase cancer. So avoiding all those prepackaged meals in the grocery stores, processed meats like deli meats, all of the red meat in excess amounts, all of those increase cancer risk. And then after that, it's alcohol, it's sunscreen, it's physical activity. The list goes on and on. And I try and kind of put together all the most comprehensive data and all the latest data in my book, Outsmarting Cancer.
Mm-hmm. Um, and one of the things that's come up recently too is this thing about microplastics. Is that something that is of concern to you?
Without a doubt. I mean, we know, first off, all of us are drinking something like, water bottles worth of plastics in the water every few months, right? That's how much of this microplastic there is out there. And we know that it's associated with infertility, right? Male sperm counts have gone down in recent decades. And very likely, I think in the years to come, we will see data that it also increases the risk of many different cancers because it disrupts your hormones, your endocrine system. And it's kind of one of these things where we're all aware of it, and we're truly not doing anything about it systemically. So the best thing that you can do on an individual level is use water filters, avoid plastic water bottles, avoid plastic Tupperware, especially if you're microwaving in it, plastic
Mm-hmm.
cutting boards. The more you can use other materials like metal and wood, the less at least your plastic consumption will be.
Yeah. Okay. Good. So, where get people get a hold of your book? I assume it's on Amazon. Is that right?
It's available on Amazon, at Barnes and Nobles, on the Hopkins University Press. Just Google "Outsmarting Cancer: Risk Reduction:
Okay.
The Power of Prevention," and then you can
Mm-hmm.
find many of my writings at on like for major newspapers at adambarsouk.com, ADAMBARSOUK.com, as well as links to the
Okay.
book.
Okay. And they can reach you there if they want to contact you and follow up in any
Of
way.
course, yep. On X, on Facebook, Instagram, please reach out, follow me. I'm always happy to answer questions.
Okay. Well, terrific. Well, thank you very much. I really appreciate it. Again, this is National Cancer Prevention or Awareness Month. So obviously we should be aware of every month, but it's good to have a focus every year. So thank you very much, and I wish you well.
My pleasure. Thank you.